Welcome to the Senior Health video. This video will talk about 5 hidden lupus symptoms you should never ignore. Have you ever felt like your body was sending you signals that no one could explain? The exhaustion that never seems to fade, the strange rash that appears after just a few minutes in the sun, or the ache in your joints that comes and goes without reason. Most people brush these moments aside, blaming stress or age. But what if those small, confusing signs were actually your body's cry for help? What if they were the first whispers of something far more dangerous hiding beneath the surface? Here's the alarming truth. Every single year, thousands of Americans walk into their doctor's office with symptoms that look like dozens of other conditions, and they walk out without answers. Many of them are later rushed to the hospital with kidney failure, severe lung damage, or even brain inflammation before anyone realizes the real culprit was lupus. This silent autoimmune disease can attack almost any organ of your body: your heart, your skin, your brain, your kidneys, without warning. It is known among doctors as the great imitator because it disguises itself as other illnesses and tricks even experienced physicians. That is why lupus often goes undetected for years, quietly destroying the body from the inside out. But there is hope, and it starts with awareness. The difference between lifelong complications and a full recovery often comes down to one thing: catching the signs early. When you know what to look for, you can protect your organs, preserve your energy, and take back control of your life before it is too late. Today, Dr. Micah Yu, an integrative rheumatologist who has treated countless patients across the United States, will reveal the 5 early warning signs of lupus that most people and even many doctors miss. By the end of this video, you will know exactly what your body is trying to tell you and how to respond before irreversible damage occurs. Because in the fight against lupus, knowledge is not just power, it is survival. Number 1, joint pain and stiffness. It often begins quietly. You wake up and your fingers feel stiff, your knees ache, or your wrists feel heavy. You think it is just age or maybe overwork. But when that stiffness lasts more than 30 minutes and improves only after movement, it could be one of the first warning signs of lupus. What seems like simple arthritis is actually your immune system attacking your own joints. Inside your body, inflammation is spreading. In lupus, the immune system mistakes healthy tissue for danger and releases chemicals that damage joint linings. The pain comes and goes, often worse in the morning, and moves from one joint to another. Studies show that about 90% of lupus patients report joint pain early on, sometimes years before diagnosis. Ignoring these signs can be dangerous. Inflammation does not stay in one place. It can spread to the kidneys, lungs, or heart, leading to lasting damage. That is why early testing matters. Ask your doctor for ANA, an anti-dsDNA test, to check for autoimmune activity. The good news is that small actions help. Eating anti-inflammatory foods like salmon and blueberries and doing light morning stretches can ease stiffness and protect your joints. One patient thought her wrist pain came from gardening, but it was lupus. She caught it early and saved her health. But knowing this alone is not enough, because another warning sign can appear on your skin, and it is even more dangerous. Number 2, sun sensitivity and skin rashes. It often begins with something you do every day: stepping into the sunlight. Within minutes, your skin feels hot, turns red, or starts to itch. You think it is just a mild sunburn, but if it happens too quickly or too often, it could be a sign of lupus. This condition makes your immune system overreact to ultraviolet light, causing inflammation that attacks your skin from within. Here is what really happens. In lupus, exposure to sunlight triggers immune cells to release proteins that damage skin cells. This leads to redness, blotches, or the well-known butterfly rash across the cheeks and nose. Some patients even develop thick scarring patches called discoid rashes that never fully fade. Research from the Mayo Clinic shows that nearly 2/3 of lupus patients are photosensitive, and many develop rashes before any other symptom appears. Ignoring these rashes is risky. They often signal that lupus is becoming active inside the body, not just on the surface. Protecting your skin can help calm the immune response. Use sunscreen every day, wear hats outdoors, and avoid harsh sunlight during peak hours. A patient once thought her rash was an allergy, but it was lupus attacking her skin and kidneys. Early care reversed the damage. But knowing this alone is not enough, because the next sign hides even deeper inside your body, and it can strike without warning. Number 3, recurrent fevers without a clear cause. It often begins with a low fever that comes and goes without reason. You feel warm, drained, and achy, but there is no infection, no flu, and no clear cause. Many people ignore it or blame stress, but when fevers return again and again, it could be one of the first internal signs of lupus. This disease confuses your immune system, making it attack healthy tissues and release chemicals that raise body temperature. Doctors call this a fever of unknown origin. When tests show no infection or cancer, autoimmune inflammation becomes the likely cause. In lupus, immune cells stay in overdrive, constantly releasing inflammatory proteins. Research from Johns Hopkins Medicine shows that about half of lupus patients experience recurring fevers early in the disease, often months before other symptoms appear. Ignoring these fevers is dangerous. They signal active inflammation that can harm the heart, kidneys, and brain if left untreated. If your temperature rises above 100.4 degrees or more than once a week, without a clear reason, ask your doctor about ANA or anti-dsDNA testing. Small steps can help reduce inflammation. Stay hydrated, rest well, and eat anti-inflammatory foods like spinach, salmon, and turmeric. One patient thought her low-grade fevers were hormonal, but it was lupus. She caught it early and protected her kidneys. But knowing this alone is not enough because the next symptom can change your appearance and your confidence in ways you would never expect. Number 4, hair loss or thinning hair. You notice more strands on your pillow, your brush, or in the shower drain. At first you think it is stress or aging, but as the weeks pass, your hair feels thinner and your scalp becomes tender. This could be another early warning sign of lupus, a condition where your immune system attacks the tiny follicles that grow your hair. Here is what happens beneath the surface. In lupus, inflammation damages the scalp's blood vessels and disrupts the normal growth cycle of hair. Sometimes it appears as diffuse thinning, while other times small bald patches form where hair never grows back. Dermatology research shows that nearly half of lupus patients experience noticeable hair loss early in their illness, often before diagnosis. Ignoring this sign can have deeper consequences. Hair loss in lupus is not just cosmetic, it signals active inflammation that can also affect your skin and organs. If you see unusual thinning or patchy loss, ask your doctor or dermatologist about tests for autoimmune activity. The good news is that early care can help reverse it. Anti-inflammatory treatments, gentle hair products, and nutrient-rich foods like eggs, salmon, and avocados can support regrowth. One patient believed her hair loss came from stress, but testing confirmed lupus. Early treatment helped her hair grow back stronger. But knowing this alone is not enough because the next sign is invisible, yet it drains your body and spirit more than any other. Number 5, unexplained fatigue. You wake up tired even after a full night's sleep. Your body feels heavy, your mind foggy, and the smallest tasks feel overwhelming. You drink coffee, you rest more, but nothing seems to help. This kind of deep, unrelenting fatigue can be one of the earliest and most overlooked signs of lupus. It is not normal exhaustion, it is the result of your immune system attacking your body from within. Here is what is happening inside you. When lupus is active, immune cells release chemicals that inflame tissues and disrupt energy production in your cells. The result is constant tiredness that no amount of rest can fix. Studies from Harvard Medical School reveal that over 80% of lupus patients report chronic fatigue before any other major symptom appears. Many mistake it for stress, burnout, or age, losing precious time before diagnosis. Ignoring this fatigue can be dangerous. It often signals active inflammation in your blood vessels, heart, or kidneys. If you feel tired without cause for more than a few weeks, ask your doctor to check for autoimmune markers like ANA. There are simple ways to restore strength. Prioritize rest, eat anti-inflammatory foods, and manage stress through gentle activities like yoga or walking. One patient thought her exhaustion was depression, but it was lupus. Early care restored her energy and hope. But knowing this alone is not enough because lupus can also hide where you cannot see it inside vital organs like your kidneys, creating silent damage long before symptoms appear. Additional warning signs. You should never ignore sometimes lupus hides in places you cannot see, quietly attacking the organs that keep you alive. One of the earliest and most serious clues appears in your urine. If your doctor finds protein in your urine, it could mean that lupus is already targeting your kidneys. Healthy kidneys filter out waste but keep protein inside your bloodstream. When protein begins leaking into your urine, It signals that inflammation is damaging those delicate filters. Research from the National Kidney Foundation shows that up to half of lupus patients develop kidney involvement early in the disease, often long before they notice any pain or swelling. This makes it one of the most dangerous silent symptoms. The best way to detect it is through a urine protein to creatinine ratio test. If that number rises above 500, it means your kidneys need urgent care. Another warning sign hides in your breathing. Some people notice shortness of breath, tightness in the chest, or a dry cough that never goes away. These can occur when lupus inflames and scars the lung tissue, a condition known as interstitial lung disease. When this happens, your lungs struggle to deliver enough oxygen to your body, forcing your heart to work harder. If you feel out of breath after light activity or even at rest, this could be your body's alarm system. Ignoring these signs can be life-threatening. Lupus does not limit itself to joints or skin. It can quietly destroy vital organs before you realize it. Early diagnosis and treatment can prevent irreversible kidney or lung damage. Regular checkups, blood tests, and urine screenings are your best defense. But knowing this alone is not enough, because the story of lupus is not just about symptoms. It is about recognizing the battle within and learning how to fight back before it is too late. If you have made it this far, you now understand that lupus is not just a disease of the joints or the skin. It is a complex condition that can touch every part of your body, often in ways that are easy to miss. The most important lesson is this: early recognition saves lives. By paying attention to your body's signals, from joint stiffness to skin rashes, from unexplained fevers to fatigue, you can take control before serious damage occurs. Here is the truth that brings hope. Lupus does not have to define your life. With awareness, timely medical care, and a few lifestyle changes, you can protect your organs, restore your energy, and continue living fully. Eat nourishing foods that calm inflammation, stay consistent with gentle movement, and practice daily self-care. Ask questions, seek support, and never ignore what your body's trying to tell you. Every step you take toward understanding your health is a step toward healing. If you or someone you love has experienced any of these warning signs, do not wait. Talk to your doctor, schedule the right tests, and make small changes today. Healing begins with action, not fear. You are never alone in this journey. There is always help, and there is always hope. In our next video, we will explore the foods that strengthen your immune system and help manage autoimmune conditions naturally. Save this video, share it with someone who needs it, and subscribe to our channel to receive the latest health tips, nutrition insights, and practical care advice designed especially for seniors. Your health is worth protecting, and together we can make every day a new beginning towards strength, balance, and peace.